This morning, a Nederland boy fighting a rare disease. He's at the Texas Children's Hospital right now, but it all started at his home in Nederland where he began showing COVID-like symptoms. Our Kara Willis joins us live from Beaumont with more on his story. Good morning, Kara.
Good morning, Nick. I'm here outside of St. Elizabeth Hospital where that 12-year-old boy started his health journey. He's now at Texas Children's Hospital in a coma, and just overall sad story. His mom is staying strong for him as he's battling this rare COVID-related illness. Take a look. Missy Lowe's 12-year-old son, Drayden, is fighting for his life.
His whole body on the inside was inflamed. Every organ was inflamed.
Drayden has never tested positive for COVID, and he's vaccinated. But according to Texas Children's Hospital, he has been diagnosed with a rare illness related to COVID. It's called MIS-C.
But he's just an all-around healthy kid. He's never had any kind of sickness, no underlying health conditions. I don't even think he's ever had a fever over 100 until now.
Drayden started complaining about sudden aches and pains. Lowe says she noticed his face turning blue, so she rushed him to St. Elizabeth Hospital. After tests and surgery, Lowe says his severe condition is what led him to be transferred to Texas Children's Hospital in Houston. He's now in the hospital bed you see here in a coma. Doctors are still researching MIS-C. Dr. Amy Arrington from Texas Children's Hospital says they still don't know why the illness affects some children and not others. According to the CDC, children and adults can contract MIS-C 4 to 6 weeks after a COVID infection. Once contracted, different body parts such as the brain and heart can become inflamed. Symptoms can include fever, diarrhea, dizziness, skin rash, or vomiting.
He probably had COVID in between that first and second shot.
According to Arrington, there are no proven links between these symptoms and the vaccine for kids. She says there's no prevention for MIS-C.
Be home before you know it. Just let yourself heal, okay?
Again, Dr. Arrington says that there's no prevention for MIS-C at this time, but if you notice any of those symptoms, you're advised to go to your doctor immediately. But in the meantime, she says the best prevention and the best help you can do for your child is to get them vaccinated. Live in Beaumont, Kara Willis, 12 News.